She's a fighter. She is an excellent girl ever since she was a kid, but she's really good at almost everything what she does.
Milena first started to vomit on October 31st on a Halloween night, and it continued, and she experienced everyday nausea.
And it was a really bad experience because I couldn't eat anything because then I would just throw up, and I hated that feeling.
Then my wife took her to see the doctor, and he prescribed medicine to stop the nausea, but it continued.
By Christmas, we noticed that she started losing balance.
It wasn't until they went in for a hearing test that the outside community ear, nose, and throat doctor diagnosed the hearing loss, was smart enough to order the MRI, and that's how the tumor was diagnosed.
It was the worst news you can receive. The doctor said, I'm going to connect you with Dr. Leonetti and Dr. Anderson from Loyola. And they are the top doctors in this area for acoustic neuroma.
I explained to her that it's a benign tumor. It was going to require surgery. He had to admit her that night because of the pressure on her brain from how big the tumor was.
There was obstruction of the ventricular system. The fluid in the brain was expanding rapidly at this point, and it was a life-threatening situation.
And I told her that Dr. Anderson is my partner. We've worked together for 35 years. We've done over 2,000 operations together, and you will be in the right hands. It won't be just mine or just his. It's collectively a group of hands.
After we talked with both Dr. Leonetti and Dr. Anderson, within 10 minutes we were out of a house heading to Loyola.
Because of how high her intracranial pressure was, Dr. Anderson really saved her life by putting a drain in.
And that took pressure off of the fluid that had accumulated.
He stabilized the situation and bought us some time, and we operated the following Tuesday.
The surgery lasted for more than 12 hours, and of course it's the longest 12 hours in my life.
The tumor had caused significant hearing loss. We were unable to bring back. We never can bring it back. But we needed to save the facial nerve and other nerves, the nerves that are responsible for speech and swallowing, nerves that provide feeling to the face.
Around 8 o'clock at night, they wheeled her in a room, and we were so happy. Dr. Anderson was here, all the resident doctors, and I see so much happiness in their face. I see how proud they were of the work they did.
And she's doing exceedingly well. She has normal facial function. She has normal function with regard to gait.
After 6 weeks after the surgery, we were able to work with the audiologist, and they were able to give her the cross hearing aids that she's wearing now. So only 2 months later, and she looked like nothing happened. I'm gonna be always grateful how they took care of her day and night.
When patients thank us, sometimes I feel like saying thank you for coming here. Thank you for giving us the chance to help your loved one.
She wants to be a nurse, and maybe one day she'll work for Loyola too. You don't know.